Are you feeling overwhelmed trying to figure out when you really need antibiotics and when they might actually make things worse? Trust me, you're not alone in this confusion. Today we'll break down the real differences between viral and bacterial infections and uncover some hidden dangers that come with taking antibiotics unnecessarily. So before you request that next prescription, stick around. You might be surprised by what you learn. Welcome to our channel. Ever wondered why your doctor tells you no antibiotics for a cold or been worried about drug resistance? You're absolutely in the right place. We're here to clear up the most common myths about antibiotics, explain exactly how to tell the difference between viral and bacterial infections, and help you make the safest choices for your health and your family's well-being. Let's jump right in. Let's break it down together. Bacteria are these fascinating, independent, single-celled organisms. They can live, grow, and reproduce all by themselves. Now, viruses, they're even smaller and honestly a bit sneaky. Viruses need to hijack your own cells just to make copies of themselves. So why is this important when it comes to treatment? Antibiotics are designed to target things only bacteria have, like their cell walls or the way they reproduce. But viruses don't have those features, so antibiotics literally do nothing to them. For viral infections, what you need is antiviral medicine, or sometimes just patience and rest. When you know what you're fighting, you can make much better choices about your treatment. Now, if bacteria and viruses are so different, you might wonder, why do their infections feel so similar? Ever had a fever, sore throat, or body aches and found yourself puzzling over whether it was just a cold, strep throat, or maybe even the flu? You're definitely not alone. Here's the thing, symptoms like cough, fever, and sore throat can show up with both types of infection. But there are hints. Severe, sudden pain, say a sharply sore throat with visible pus, or a high fever often points toward bacteria. Meanwhile, mild and more generalized symptoms like a runny nose or all-over aches usually suggest something viral. That said, in the early days, things can look pretty much the same, which is why self-diagnosis is tricky. When you're not sure, it's always best to check in with your doctor. Let's clear up some of the biggest myths about antibiotics. First myth, antibiotics cure everything. Nope, they only attack bacteria, not viruses. Next myth, if I take antibiotics, I can stop a virus from turning into something worse. Also not true, and it can actually be harmful. And finally, it's fine to stop antibiotics as soon as I feel better. That's another common mistake. Taking antibiotics you don't need or not finishing the full course can bring on nasty side effects like nausea, diarrhea, allergies, and most concerning, bacterial resistance. This resistance means certain infections get much harder to treat, so myth-busting really can save lives. Taking antibiotics when you don't need them doesn't just affect you. Over time, the bacteria out there can adapt and become immune, creating what we call antibiotic resistance. Imagine a world where infections we used to treat easily become dangerous or even deadly because our medicines just stop working. Resistant infections mean longer stays in the hospital, bigger medical bills, and unfortunately more lives lost. This isn't just a problem for some people, it puts everyone at risk, especially infants, the elderly, and anyone with a weaker immune system. The best way to protect yourself and your community: only use antibiotics when they're genuinely necessary.